Scott asked, he's thinking about trying HCG to help with better orgasm intensity. He's using cream now and feeling otherwise great. 250 every other day, is that a good starting point? Could too much DHT be an issue, so worth switching to shots?
This is the TRT and Hormone Optimization YouTube channel. And if you want to learn all about the science-based information on this topic, consider subscribing, hit that notification bell, and you'll be on your way.
Too much DHT can lower SHBG, it can lower E2. It really comes down to how he feels. And I would say, when you say better orgasm intensity, you have to contrast with what it was prior. I mean, did he have good ones and then the volume decreased, the intensity decreased, or was it always kind of lackluster and he's trying for a boost? HCG is not going to necessarily give you a boost. It's probably just going to restore at best to what you had previously. But yeah, if you've been on TRT or any sort of replacement exogenous hormone for a long time and you've been suppressed, expect a decrease in volume and possibly intensity. It can't hurt to try. You don't necessarily have to go every other day. It is a very fast-acting med, but fast-acting doesn't mean fast or short-lasting, because the activity that it generates can have a lasting effect. So twice a week on HCG is sufficient. You don't have to really pin it every other day, unless you're really looking for a kickstart protocol from a fully suppressed state where you're coming off hormones. If you're looking to add it to your TRT, twice a week should be sufficient. 350, 400 I use. You can go up to 500 as long as you're not feeling poorly on it. Give it a shot for a month, and if you don't like it, discontinue and it's out of your system. But yes, it should help with volume.
Mm-hmm.
Jordan?
Yeah, it's not something I ever really, people don't bring it up that much. My patients don't. So it's not, and like I say, I'm open to whatever. Like I always tell patients, I'm more of a facilitator, a guide. If they want to try something that's safe and they're dialed in on testosterone and they say, hey, I'd like to try some HCG to do whatever, okay, let's try it, and I can't always explain all these mechanisms about sensitivity with HCG and all this. I've looked, it's not clear cut. So the best way to know is to try. And I don't think you're going to hurt yourself with a small amounts of HCG added to your TRT.
Unless you use an 18 gauge.
Freaking harpoon. Yeah, don't do that. I had one patient doing that. I was like, don't do that. The DHT thing with the cream, I know that, I'm probably the one that it's not as, again,
not as potent as people like to believe.
Well, DHT serum level is not telling you squat, okay? Like, it's not. It's just like E2.
Another paracrine hormone that's...
Yeah, your DHT is
enzyme,
made locally in the tissues. So that level you're getting is not necessarily reflective. I have a guy who switched from creams to injections, got his blood work. His total was less on the injections, but his DHT, he checked it himself, was higher on the injections than the cream. So it's not all about the DHT with the cream. The amazing thing with the cream is usually you have a higher free testosterone level. Because you're doing a fast-acting daily or twice daily administration, right? And so that's the deal with a lot of the, I think, boost guys see with the cream is it's potent for a lot of guys. If they have a non-existent, layer in their scrotum, stratum corneum is thinnest in the scrotum, right? That's why we use it there. And they're just like absorbing the hell out of it. They get high free T and they feel that more. So it's just that high androgen. I don't think it's the DHT. That's just my spiel on that. So.
And this is easy to test anecdotally by just administering someone a DHT and seeing if they're experiencing the same. And because we know the DHT orals are significantly more powerful than the conversion you get out of a cream.
Yeah, definitely.
Hey, thanks for watching. And now click on one of these thumbnails to learn a ton more about TRT and hormone optimization.